Dr. Zymantas, let's talk about brushing teeth. There's hard brushes, soft brushes, electro brushes. What should one do? And is it really all as cracked up as it is supposed to be? Some people brush very well and still need to go to the regular cleaning and have lots of plugs on it. Other ones are more on the lazy side and don't really seem to accumulate all that much plug. So tell us a little bit about cleaning and how we should go about it.
Yeah, well, first of all, we recommend using a soft brush. Soft bristle brush is always recommended. Most dental brush makers nowadays make the diameter of the bristles a specific diameter so it does get underneath the gum line. The biggest problem we find is that most patients don't really know how to brush their teeth. And it takes my hygienist usually sometimes a year. It kind of depends. Some people catch on really quick. Some people it takes a little while for her to kind of reinforce proper habits, how to get in there effectively and how to brush. We highly recommend electric bristle brush. Aurora IL is my favorite. I think it's the best brush out there. And if you clean your teeth in a systematic way, brushing each tooth for 3 seconds minimum, it should take about 3.5 minutes or so to do the entire mouth if you spend that much time. And if you do that once a day very, very well, that's more important than doing it 5 or 10 times just kind of haphazardly. It's more about the quality of brushing is very, very important. It's all about how well can I disturb the bacteria that's growing on the roots of my teeth. And if you can disturb those bacteria in an effective way and often enough, your chances of having issues or problems in the future are almost zero. A person that's 18 years old, if they're doing a great job brushing their teeth and they have no structural or grinding problems or other types of problems like that, their gums and their bone levels should be about the same when they're 90 years old. And again, it's all about how well and how effectively they brush their teeth. The bristles should be pointed up into the gum line, not with a lot of force. The Aurora IL electric brush, one of them does come with a special sensor that shows you if you're pressing too hard with your bristles, how long you ought to be brushing your teeth. So it's kind of helping reinforce good habits.
Okay. Well, what about flossing? There are all kinds of flosses out there. Do they really make a difference, or is this just a personal liking?
Personally, they supposedly, and I've never really read a full study, but say like there's some really slippery flosses that get in between the teeth very easily. They're like Teflon coated type of flosses. Glide is one of them. And then there's other types made out of fibers. And personally, I like the fibrous ones, a thicker type of floss without wax, because I believe the more resistance to cleaning the roots of the teeth is what's going to clean the material off. I have some patients who don't like the slippery ones at all because it just seems like it's not doing an effective enough job. Studies show that it probably does do as an effective job, but to me, I don't feel it does quite as good a job as some kind of regular dental floss that's a little bit thicker in nature, so that you can really scrub the roots of your teeth. Because when you're brushing your teeth, as you get further back, your teeth get wider and the bristles do not penetrate in between the teeth very well. So you need to do something else, which is using dental floss or little other type of auxiliary devices to clean in between your teeth in the back.
Okay. And so when same like with brushing, let's go back a little bit. When you floss, I know that you go on the sides of your teeth up and down and all that stuff, but and I do that, I just don't know whether I do something bad, good, or something indifferent here, is I kind of like put a lots of attention to massage actually the gums. So basically I press it relatively hard up or down into the gums and kind of go like this between the teeth so that I massage the gum. Am I doing this totally wrong or more like right? And tell me.
Well, the idea is not really so much to massage the gum. the idea is more actually to be scrubbing the root of the tooth. But in order to get down to the base of the space in between your tooth and your gum, what we call a pocket, in order to get down in there, you definitely will be meeting resistance of the gum tissue, and you need to go beyond where it's just kind of sliding down. You need to have it where you're starting to feel resistance. So that's probably what you're doing, is doing it correctly. You just may be interpreting it that you're sort of massaging the gum. Again, You don't really want to be massaging the gum. You want to be more doing a scrubbing motion, pulling on one side of the tooth and scrubbing the front of the back tooth, and then pushing or pulling against the front tooth and scrubbing the bacteria that way.
Okay. And what about when you brush? Are you only brushing the white part of the teeth and or also the gums? Basically, again, I use the word massage the gums, activate the gums, get the blood going in it. Are you doing it like half-half? And is that how the bristles go below?
The bristles should be pointed at a 45 degrees to long axis of the tooth. So say if this is 0 degrees and this is 90 degrees, when you're brushing, your bristles should be pointed up into the gum line or on the lower teeth down into the gum line at a 45-degree angle so that you can clean out the little groove where the bacteria start to collect and the most problems begin. And if the plaque is not disturbed frequently enough, then those tissues will start to break down and you will develop gingivitis or periodontitis if it keeps going on for a longer period of time.
Got it. And about 15 or so years ago, I lived for a couple of years in India. And almost everybody in India used a gum scraper, a tongue scraper actually. Is that a good thing to do? Can or should one, if one doesn't use a tongue scraper, if it is something one should do, a toothbrush, would that have, and brushing the tongue, is that something which should be part of it or not really? Is that just a fancy something which has no purpose at all?
No, I highly recommend using a tongue scraper as well. You can use your toothbrush, but sometimes I kind of do tests on myself, seeing how effective just brushing with a brush on the back of my tongue versus using a good tongue scraper. And I find that there's still kind of this gunky stuff that collects. Your tongue is basically like a carpet. So the bacteria kind of get down into the base of the threads of the carpet, and some of those bacteria are sulfonic type of bacteria that will use sulfur and give off sulfur compounds. And those sulfur compounds are the number one reason for bad breath. So the more you can minimize those bacteria that are living in the base of the tongue, inside the threads of the tongue, then the better your breath will smell. That's for sure.
Okay. So it is a good thing to clean your tongue.
Absolutely. You minimize the bacteria in your mouth. You're not going to get rid of the bacteria. That's not the purpose. The purpose of brushing and flossing, say, is to disturb the bacteria where the bacteria can create a biofilm and where they can stay stagnant. So as long as the bacteria are floating around your mouth, it's not a big deal. But once it attaches to your tooth or to your tongue, then they develop families. And those families, or the biofilm that's soon coming after that, that's what causes all of the problems.
Very informative, Dr. Zymantas. Thank you very much.
And thank you, Mr. Flash.